Hello, good morning, good afternoon, and good evening, everyone. Today, we will be discussing BTL focused shockwave therapy, a versatile technology with many applications. While focused shockwave therapy is used in various fields across the medical, our focus today will be its specific and significant application in urology, and mainly and particularly for men's health. So this will be the goal of today's session. And I would like to welcome all of our speakers who will share their expertise and insights. We will begin with Mr. Xavier Rajaratnam, the CEO of Excel Health from the United Kingdom. In his presentation, he will provide a general overview of focused shockwave therapy, of its mechanism of action. He will be also explaining the technology itself. He will also share his experience on why and how they incorporated focused shockwave device and technology into their clinic, and he will also speak about what does it bring to them. Following him, we will have a Professor Peter Lim, a renowned urologist from Singapore, who will share his experience with various modalities in men's health. Professor Lim will also be discussing his signature protocols and approach, how he's treating and evaluating the patients. And finally, we will hear from Dr. Afik, a general practitioner, a head of men's health at USMA Clinic in Malaysia, who will provide his valuable perspective from a general practitioner. We are confident that this session will be both informative and engaging. With all that, let's get started. I would like to hand it over to our first speaker, Mr. Xavier Rajaratnam.
My name is Xavier. I'm a physical therapist from England, and we are based not too far from London. And we have 7 clinics, and we use this PTL focus shockwave therapy in our regular part of our treatment. And the clinical outcome is really, really successful. And as a physiotherapist myself, the amount of clinical betterness we bring to the patients are immeasurable. So I want to talk about how we use this shockwave in our practice and what are the conditions we could treat as a physiotherapist, and some of the conditions which is the science is emerging, mainly the erectile dysfunction, non-union of the bones, all those things I'm going to talk about. Then finally, I'll talk about how we incorporated this newer device in our practice, how it made sense as a business to our clients and as a business for us. So most of you know the definition of the shockwave. It is, as it says, it is a shock wave which goes into a human body with a high and a fast intensity with a positive pressure, and that is peaking up, then slowly degrading the pressure, and it stays within the body for longer, creating the healing of the tissues for long enough. And this shock wave will be able to carry a high level of energy into the body, which no other equipment could deliver so far. We have used ultrasound for many years, we have used radial shockwave, and we have used our hands for many years. But this newer technology, it never been in the market where this level of the high intensity with a positive pressure, which goes into the human skin and the fascia, soft tissues, to create the clinical outcome what we are looking for. So in technology background, why do we use this equipment? What are we aiming to achieve? We mainly use this for chronic conditions. These are the problems which is lingering around in your body. As a physiotherapist, you get frustrated that, I've tried my hands-on treatment, I've tried ultrasound, I've tried various other methods, but still can't get the best outcome, which is matches to the client. So I use in pretty much all the chronic conditions, musculoskeletal area, so that we enable the repairing process and the healing process to get going. As a clinic, we are using across the all the locations we have is bone healing. So we work with a hospital group and any clients who are struggling with their non-union, and they come to us and we use this equipment and the tool. It really helps the patients of faster healing, and even the delayed union gets much faster recovery. 2 important areas where I feel the focus shockwave has been immensely helpful to our practice and as a physiotherapist, and also in our business where people are coming back for the expert input or a chronic pain and also men's health. I'll talk about men's health in a little bit more detail because that's where the science is emerging. as a physiotherapist. I've learned recently of using this equipment to help people to get a confidence in their life so that they can enjoy the quality of life it brings. Next, well, let's talk about the men's health side of things. This statistics was mind-boggling. Before I started learning and developing my skills in men's health, you won't believe it, I thought everybody is perfectly fine, even after their 60s and 70s. I came to know around 50 to 60% of the men struggle with erectile dysfunction after the age of 50. That is a new learning for me, and there is a science behind how this is all happening due to poor vascularization and poor muscle function, all those things. There's another topic I'm learning at the moment. It is a chronic pelvic pain syndrome, and this is most common in men due to prostate problems or post-surgical of the prostate, and also perineal problems. Loads of those things can lead to the chronic pelvic health problems. And these are the two important problems, in my opinion. This many years as a physiotherapist, nearly 3 decades I'm working as a physiotherapist, and people haven't come out and talked to us as a clinician. So I use varieties of treatments, and most people who come to us have tried various other treatments and failed before we explore this option. And the sad part is many of our patient group do not understand this kind of treatments are available on the market. So we educate them so much. The first treatment most of our client group would have tried is a medication. They would have gone to the doctor, general practitioner, and would have tried various other drugs which could have caused cardiac problems. And also people who have cardiac problem, they cannot have some of the medications. There is another treatment called the vacuum constriction device that leads to bruising, numbness, and this is a very temporary solution, and mainly on the genitals. And many men do not want to have this treatment because of the side effect it brings. Last option people would have tried is a surgery. Again, as you know, surgery is very invasive. The success rates are very much mixed with a high risk of complications, perforation and urinary tract damage, and also infection in the area. Many people do not want to talk about this, and many people personally do not want to go through this procedure. What if this surgery fails? If the surgery fails, what am I going to do next? Nothing, right? That's the reason I'm advocating, shockwave therapy to most of our clients, and also we use a high from the therapy with the MSLHs. We have two of them in our practice. It turns the pelvic floor muscle in a far better way, helps the patient to strengthen them better. At the same way, it triggers the contraction within the muscle groups. It really, really works well. Okay, so please, if you're a physiotherapist practicing for a long time, go and try these things on your clients. Most of our clients would have had medications such as alpha blockers and non-steroidal anti-inflammatory drugs, antibiotics, everything, but most of them would have failed. The success rates are very, very small. And as a physiotherapist, I thought, pelvic floor exercise is only one way people will get better from the chronic pelvic, syndrome. So when we talk about men's health, I shouldn't be, if I talk anything other than the BTL machine, what we've been using, which is 6,000 focus shockwave therapy, it's completely injustice to the technology this BTL is bringing into our physiotherapy market. It has changed the world in our area for the patients with loads of chronic problems and also the erectile dysfunctions. So non-invasive treatment, and there is no side effects for the treatment, and people can discreetly come and sit in our practice just like a normal client coming for a neck pain and back pain, and they come into a room and get their treatment done and then go home. And we use the same for the pelvic floor syndrome as well, and the chronic pelvic pain syndrome too, and it has done a magic to our client groups. So much better, so much better. So otherwise, the indication wise, the 6,000 focus shockwave machine has done a wonderful job to many of our client groups. So how does it do the cell growth, which is most important in the erectile dysfunction and the pelvic pain syndrome? So when this the handheld device, which is be in contact with the skin, the acoustic waves which penetrates through the tissue very much non-invasively and promote the cell growth, or in other way, regeneration of the cells. The most common therapeutic effect we get to see will be increasing the blood flow and circulation around the tissue. Definitely neovascularization, which is the biggest pathological changes we get to see, and also symptom relief, pain relief if they had any, and that decreases slowly. And if the patient had chronic inflammation, either around the pelvic region or in the genital region, this therapy helps them to get better and better without any doubt. So when we talk about the erectile dysfunction, and it is very, very essential we understand the mechanism, how it increases the blood flow to the tissue. So as I said, it increases a better erection for men at the same time by producing loads of neovascularization, the blood vessels which go around the penile tissue and gets neovascularized. The excessive number of capillarization increase the blood flow to all the tissue. That is the reason the genital region can get a better erection altogether. And as you all know, when this problem is getting easier and easier, people get much more confident in themselves and they'll have a better relationship with their loved one, and it has changed people's life for sure. Next, let's talk about the common, chronic pelvic pain syndrome. This is another problem which is very underreported to any healthcare practitioners, be it a physiotherapist, to the doctors, mainly the general practitioners. It's very often not at all reported. And people do come with urinary problems and also lack of muscle contraction within the area. We use the same shockwave and it reduces the pain and at the same time enable the muscles to relax, and also reduction of the chronic inflammation happens. So why did we choose BTL Focus Shockwave? There are a couple of other brands available and we have trialed them before, and the main reason we chose this, it is the science behind it. I've never seen such advanced technology which has the highest lifespan of the tool or the machine, and with up to 3 million shocks without any problem. It helps quite a long time, and the penetration, it's so much better, and also the area it can cover up to 35 millimeters, and the frequency it can go up to 25 hertz. Really, really better technology than anything what we had in the past. Imagine this, if these waves can penetrate up to 65 millimeter depth within our tissue, that is really, really good job. And we never had anything before. Some of the machines in the past we have used hardly going up to 5 to 10 millimeters depth. This is innovative and groundbreaking technology. We have two machines in our practice, and so for example, as I said, we have 6 private practices across Kent, and we have them in 2 locations. Every location will refer their clients to our central location. At the same time, we get to have loads of referrals from urogyne doctors and general practitioners, and also lots of osteopath, chiropractors. They do send their clients to us. That brings in so much of client group within our business. So, and another main reason as a physiotherapy to use this focus shockwave is mainly it is a non-invasive. As a physiotherapist, most of our techniques are non-invasive treatments. Yes, that's the reason I would continue to use any other treatment which is least of the side effects and non-invasive. People do not get any further complications with it. Let's go for it. And because of the balance between the high energy flux density of the optimal focal zone in the focal size, and it really makes a difference in the clinical recovery in whichever the part we are using this focus shockwave. It is a really advanced technology, helps the people without knowing them. So as a business, as I said, I have 6 clinics across Kent, and all of them are mostly self-funding clients come through to through our doors, and we have a small portion of insurance clients as well. We see this as a newer revenue generating system, and because it's a very specialized service, people love it. People do travel 60-80 miles to come and have the service. It is a cash-based procedure, so you don't need to worry about whether the insurance companies will approve it or not. It is part of the treatment, quick and easy to administer. We use this machine to train our clinicians very, very regularly, and the machine themselves can teach our clinician what the dosage should be using and the protocols, how long we should use. Everything is in there, and the success rate is more than 90%. Hardly we had a failure of this treatment in any chronic conditions. Any chronic condition, it works magic. So how does it work for us? It is a very, very calculative. If you're a physical therapist, physiotherapist across the globe, it's worthwhile thinking. Okay, if you're a physiotherapist working in a practice, please speak to your boss or your manager or the owner to get this kind of machines going within your practice, because it adds a tool or another treatment option within our skill set. So we are not too far from London, so we are just 30 miles away from London. If you're a clinic far away from any major cities, then you could price it anywhere from £50 to £200 per sessions. Again, depending upon the pathology the patient going through, chronic nature of the problem, and the psychological damage it's doing to the client, location, and your reputation on the market. So we have a very good reputation in the market, and we have 650 five-star Google reviews. So we are a really upmarket private practice. So we charge it somewhere in the region of £90 for pretty much all the clients. So what we do is we sell it as a package. So we offer silver, gold, and bronze, and the starting place will be 3 sessions for £270. So a physiotherapist examines and tell the patient this is advanced treatment options available, and patients loving it. They go and buy a package and 20 minutes of treatment on top of the physiotherapy sessions, and we get to 35 to 45 patients every month. And if we calculate this, if we are selling 40 packages, and it can add a revenue of 10,000 plus pound in your practice. Okay, many of us will need to invest, and if you can get the money back in 4 months, 3 months, it's not a joke, is it? So whatever the investment we put in, and I think we have taken it out just under 3 months. So this is the calculation we have arrived. Actually, our earnings are slightly over 11,000 at the moment, but I'm trying to keep it very conservative so that I'm not upsetting your expectation by any means. But again, we have a large volume of the client group, and I would say 15 to 20% of our client groups needs this kind of therapy. And at the same time, it has opened up so much bigger market for our clinics. So how do we adapt into our daily practice? And we use this machine every single day, either for training or treatment sessions. And also we get regularly new clients into our practice, and we showcase these other treatment options available to the client group. So it gets used every single day. And make sure you showcase this treatment options to your wider public, either through social media or when people coming in. It really works well. It offers amazing satisfaction to our clients. They recover quickly, and that is what we mainly care about. The same way it transforms our practice, there is no way I would recommend any physios not to have this in your practice. But again, think of, if you're a business owner, think it in a different perspective. You're establishing a newer service, which we are doing, and also it brings more revenue into your practice. And with the expected investment turnover, or revenue on investment will be 15,000 to 20,000 pound. That's very, very good. And it never takes sick leave. Never come and tells you, you know what, I'm getting tired of this work. I can't do it. My hand's hurting. The machine doesn't do anything. And it works. And as we are very good relationship with the BTL, if any problem, we let them know. They come and service. Their service support is fantastic. And it is not operator dependent, because the machine can tell you as a clinician, what is the dosage, how many times, how many minutes, and what kind of settings we need to make. Everything the machine takes care of. All you need to input is the diagnosis and the chronic or acute nature. The machine does it all for you. So it's not operator dependent. Either a junior physio or well-experienced physios, you could do it all. In my opinion, it's no-brainer not to have this kind of tool in our practice, which bring highest satisfaction to our client group, highest recovery chances to our client group. So please continue to listen to our next speaker and the following speakers. They talk about how this has transformed their practices, at the same time how scientifically it's helping people, and hope you all have a great day. Thank you.
Wow. Thank you, Mr. Xavier, for truly insightful presentation. I think it was very good and great. It's fascinating, actually, to see how focused shockwave therapy is revolutionizing the clinical landscape, not just from medical perspective, but also as a powerful business solution. Because what was interesting for me, at least during your presentation, that you really hit some key points for anyone looking to incorporate this technology. And I think these two key points were, first of all, clinical success, because the clinical results you have shared are truly impressive. A non-invasive treatment with a success rate over 90% for conditions like erectile dysfunctions, it may be a game changer in a men's health. And the second part that you mentioned, and I really like how you nicely connected, was the business success, because you also provided a great business case, and you proved that the focused shockwave isn't just a clinical tool, but it's a strategical asset for actually rapid return of investment and also for growing the clinic. So this ability to deliver high quality patient care while also building sustainable and profitable business is a powerful combination. Thank you very much for it. I think it was great presentation. And with that, let's move on to our next speaker. Next speaker will be Professor Peter Lim, who will share his extensive experience and also signature protocols in this field. Professor Lim, the stage is all yours.
Well, good evening, gentlemen and ladies. My presentation will highlight special aspects of ESWT or focus shockwave therapy using the BTL 6000. Now, over this year, I've encountered 240 cases of erectile dysfunction, 18 with chronic pelvic pain syndrome, mainly due to chronic prostatitis, and 16 cases of Peyronie's disease with plugs. Now, 70% of the ED patients improve their erectile hardness score to at least 3 or 4 after the therapy. As you can see in the diagram below, those who achieve EHS 4 numbered 35%, those who achieve EHS 3, 41%. I was thinking, could I introduce new variations that can improve the end result? I indeed did this. I did a group where I started a low-dose PDE5 inhibitor before the shockwave, and in a placebo group, so to speak, they only had a shockwave without the PDE5 inhibitor started. And I found that the people who had the PDE5 inhibitor initiated and carried out during the treatment period daily 5 milligrams of tadalafil had better results. And I suspected that they needed concomitant injection of PRP. PRP stands for platelet-rich plasma. Now, as all of you know, PRP is an activator of stem cells. Now, we know that we have the precursor stem cells in the penis. If we inject PRP, we activate it to rejuvenate, to restore ailing or degenerate endothelial linings in the corpus cavernosum. And in this group, I indeed saw improvement. Finally, I thought PRP was an activator of stem cell. So why not inject actual stem cells into the penis? Injected PRP or stem cells, they improved quite well. Now let's go on Peyronie's disease. PRP and focused shockwave therapy or ESWT works well when you target it to the plugs. Now the plugs get softer and erectile function became better. It will work by softening the plugs and thereby giving maybe marginal improvement to the curvature. However, if they have painful Peyronie's disease, the pain quite magically disappears. So it's very good for painful Peyronie's disease. It also works if the Peyronie's disease is associated with erectile dysfunction. It can well restore the penis back to function. Now, there's another thing I did in my way in which I administered shockwave. All my patients underwent hemodynamic testing beforehand so that I know exactly the indication I made for the patient to use ESWT. I use this Biosonics hemodynamics machine. Now, this is what you get during the testing. You can develop an erection hardness score recorded at 10 and 20 minutes after the pre-testing intracavernosal caverjet injection. We also measure the pulse volume PVR, measured by little tourniquet-like coverings that you place on the finger and around the penis to measure the pulse volume from the penile arteries. Now, if you look at this a little busy slide, I put down how valuable hemodynamic testing can be for you. You see, let's look at number 2. Number 2 is low nitric oxide state. Now, this low nitric oxide state is exemplified in the test by a PBI of more than 0.75 and an EDV of less than 0.5. Now, this is a highly favorable profile for ESWT treatment. Now, and the indication par excellence for ESWT treatment is atherogenic ED. Now, this atherogenic ED patient will demonstrate a PBI of less than 0.75 and with a poor cable jet response. Now, I think this is the most important indication. Well, I do get excellent results with ESWT in this category. But the atherogenic patient is the prima facie case to use ESWT. Actually, basically, atherogenic means is an input vascular deficiency. And ESWT, as you have learned from the earlier presenter, how it works, it increases blood supply. It creates more blood supply. And therefore, you actually correct the vascular deficiency. And therefore, it works par excellence. Now, let me exemplify what I've just said with a real case that I specifically put up to show you. Now, look at this patient who had a mild degree of atherogenic ED. And it wasn't very severe, but it was confirmed that he has it on hemodynamic study. You can notice the PBI here is recorded. And this patient, we would classify him as a patient with low nitric oxide and with a certain degree, significant degree of atherogenic dysfunction. This is before on my left, and on my right after. You can see the pulse, the pulse volume increasing. You can see the input of blood has gone up, and you can and of course clinically the patient recorded a significant improvement in his erectile function. Look at look at before on the left and after on your right. Now that's all about the science about it. But when we do this as a doctor, we are actually also running a business, and our business must be able to be sustainable. You cannot do a losing business or you'll be closing down your clinic. So let's talk a bit about the advantages of this technique to treat patients, some business aspects, and I'll end up with a take-home message for you. Now, the advantage of BTL ESWT or focused shockwave therapy is that this machine is a very simple machine. It's very portable. You can fit to any clinic space. Now, I played with all the shockwave machines that ever came out in the last 10 years. This machine is very small, very portable. Any clinic can take it comfortably. Now, secondly, it's very ergonometrically designed, very comfortable to hold and use. And like all gadgets, it must be foolproof. It must be idiot-proof. And so the inventors have created preset menus for you. So you can switch it on. You go to the menu for shockwave, for ED, you press a button. Shockwave for painful joints, another button. Shockwave for myalgia, another button. Shockwave for tendinitis, whatever, another button. So it's idiot-proof. Now, very important to the patient, it must be pain-free. You see, some of the bigger machines, because of the design of the focusing of the shock wave, this machine has the least pain in all the other compared with other machines. Now, again, when you use it, you realize that it hardly makes any noise, so nobody is disturbed. If you use some of the older machines or some of the other machines now in the marketplace, you hear bong, 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 disturbing the whole clinic. That won't do, is it? And your neighboring clinic may even complain against you. So this is the best machine in terms of sound that I've encountered. Now, patient acceptability is simply excellent. And most importantly, to the young doctor starting a clinic, it is highly affordable. It will not break the bank. And you can get very, very good terms from the company. Now let's talk about other business aspects. Now, when you talk to a patient about ED treatment, this is a doctor-led option for you. You can lead the patient to this treatment in your counseling. My advice to young startups. Now, during the treatment, you must be supportive to the patient and continuously communicate with him. Explain to him what's happening, that it is causing angiogenesis, is causing restoration to the corporal tissue, the endothelial lining, and so forth. Encourage the patient throughout, but explain that doing the shockwave today it doesn't mean that tonight you will have the good result. Results take time because the changes need to take place. The new blood vessels have to grow. Everything has to take time. And I always encourage them that during the time of waiting, there will be signs that things are improving. And I can tell you what works for me. I tell them that at night when you sleep, when we are able to function, we have nocturnal penile tumescence, nighttime erections. So I tell them that at night, when you begin to see the return of nocturnal penile tumescence episodes, is a signal to you that you are improving. Medical science is improving. We are finding new ways to augment the efficacy of ESWT. Already by itself, in medicine, anything that is successful, 70 to 75%, we tell them, is considered a blockbuster. I've said and presented to you the blockbuster minimally invasive therapy for erectile dysfunction. And so, in my take-home message, let me reiterate that focused shockwave therapy, or more commonly referred to as ESWT technology, is something here to stay. It is effective, and surely it can be proved by evidence-based studies. I've done hundreds of patients proving it works, and there are many more papers we can pull out to show you. Hemodynamic profiles help identify the best candidate. The method I showed you has the best acceptability in my hands. After doing all this for the last 40 years now, you can combine it with PD-5 inhibitors, platelet-rich plasma injections, or stem cell injections. And these can enhance results. The treatment is patient-friendly. It is extremely comfortable. And indeed, many of my patients, when I'm doing it, fall comfortably asleep until I wake them up. And for you, the doctor who actually is running also a type of business, when you run a clinic, this is indeed cost-effective. This doctor-led approach, which I've outlined today, will ensure optimal outcomes when you treat your next ED patient that comes into your clinic. Thank you for your attention.
Thank you very much, Professor Lim. That was incredible, detailed and evidence-based presentation. It's clear that your approach to focused shockwave therapy is not clinically successful as you present, but also scientifically proven and rigorous. So I really liked the presentation, and if I should highlight something, I would definitely highlight the way and your approach, how you are doing this patient profiling, using these hemodynamic guided decision protocols, which is great innovation, by using like this modality to testing and identify best candidates. You are not just only offering just a treatment, but you are offering actually highly targeted and personalized solution that maximize your success. Thank you very much for it. And now let's turn our attention to our final speaker. Our final speaker will be Dr. Afik, a general practitioner and head of men's health at Uzma Clinic in Malaysia, who will provide us with his perspective on men's health.
Good day, everyone. I would like to introduce myself first. My name is Dr. Muhammad Afik. I am a medical officer in a clinic called Clinic Uzma, which is located in Kuala Lumpur, Malaysia, in a place called Kelana Jaya. We are a 24-hour clinic providing multiple general practice services, which includes chronic illness, acute illnesses, emergencies, antenatals, physiotherapy, and also men's health, which will be the focus of our topic for today lah. We are one of the biggest clinic around here with average of about 200 plus patients a day, which the services is provided within 24 hours in every days. In terms of myself, I'm in charge of the men's health department of the clinics. I'm addressing multiple issues regarding men's health, which includes erectile dysfunctions, premature ejaculations, STDs, removal of foreign bodies, which is like a small surgery, and circumcisions. So as you guys know, the ASWT is actually a non-invasive, which use acoustic waves delivered to pineal shaft and the head to stimulate tissue remodeling. Proposed mechanisms are microtrauma caused by the acoustic waves, which stimulate new blood vessel growth or angiogenesis through nitric oxide pathway activations, which improves endothelial functions. And also it has been postulated that it also helps in terms of nerve regeneration of the penis. All of this actually its goals are to improve our natural erectile function beyond symptomatic relief of by using PDE5 inhibitors. So this is pictures of our ESWT machine in the clinic. It has already determined settings for different indications. Apart from erectile dysfunction, it can also be used for tendinopathies, chronic pelvic pain syndromes, bacterial prostatitis, and others. So in terms of the machine in our clinic, we do marketing as well, mostly on all social media platforms. But we do notice that the most engagement that we get is actually from TikToks. So in order for us to remain, what do you call this? To remain within our ethical values, we only do marketing videos that covers like educational videos. And so as you can see, the videos on TikToks has very good engagement. And as example on this shown here, one of the videos achieved like 470,000 views. This one achieves 123,000 views, and all the others are around the same amount of views. So most of our patients, we get it actually from TikToks. We do not do any paid marketing because from organic marketing also we already have a lot of customers from that. So ESWT started to be used in our service since June 2024. From the first year that we started in June until December, we already achieved about 304 patients for only that 6 months in the first year that we have it. In the next year, we notice increment in our total patients, which is totaling about 488 patients from January till September recently. And ESWT in USMA is mainly used for treatment of erectile dysfunction, which is our main focus. And sometimes we use it also for prostatitis and chronic pelvic pain syndrome. As you can see from the graph, our patients from the first year up until now has only shown increments without any cost for marketing, as we do marketing only in terms of organic marketing only on TikToks and also all social media platforms. In terms of pricing structure, for the first trial, we provide a price that is much less than the normal price that we give to patients. For those who have tried before and decided to come for like only one sessions, we charge around 160 euros. And for those who like to purchase a package, which is you buy four and you get one for free, the total is about 645 euros. So as you can see here, from the marketing and also the pricing structure that we've already set up, we've managed to generate revenues of about 100k euros in less than 2 years. So about the ROI that we achieve from the machines itself is about only took about 10 months. So it is one of the best investments so far we have done for the clinic. So in terms of for those of you who decided to integrate ESWT in your sessions, you have to make sure that you need to do a proper workflow integrations if you decided to put the service inside your clinic. It involves like consultations in terms of history, in terms of examination, and then you have to educate patients because this service is quite new, relatively very new to patients. Most of them, they don't know about ESWT. Most of them, they only know about PDE5 inhibitor like Viagra. So once we mention about ESWT, most of them don't know about it. So you might need to take more time to explain to patient what is the ESWT before you proceed for the treatment. In terms of follow-up sessions, assessments as well, you still need to do the scoring, the IIEF, the EHS scoring, the lab monitoring, and patient feedback. So who are the typical patients that come for ESWTs in our clinic? Mostly they are men ranging from 20s up to 70s. But the highest age group is around 30s and 40s. Most of them has about mild to moderate vasculogenic ED patients. Most of them already tried other treatments from outside. Either they buy online medications, either PDE5 or herbal medications. So after those treatment fails or have suboptimal response, then they come to us for treatments and for ESWTs. So in our clinic, we promote holistic therapeutic approach, not only ESWTs. Of course, ESWT, we start after we have already educated the patient about PDE5, which is a first line medication, about lifestyle modifications that patient needs to do proper diet, exercise, stress management, and sleep optimization, risk factor control. Most of them, they have problems with diabetes, hypertension, dyslipidemia. All of this we need to address apart from just doing the SWTs. So after all, mentioning all of this, most patients actually, they prefer to do ESWT, mainly because number one, it is an external application. So most of them, they don't like medicines that needs to be ingested because for fear of side effects, dependence, and all those things. Number two is because of ESWT itself is a very simple procedures and it provides promising results. And also it has only minimal to no discomfort at all. So that's why a lot of patients coming to us, even after we advise them for combination of treatments, most of them actually prefer only ESWTs. So I would like to share to you a few of our case studies so that we have more general ideas what we are doing over here. So case study number one, is Mr. RK, 43-year-old. He is a known case, KCO is a known case of diabetes mellitus. He has ED since 5 years with IIEF score of 12/30 in erectile domain and also EHS grade 2. So what we did was we gave a total sessions of 5 sessions of ESWT with 2 weeks to 1 month apart due to distance setting of about 60% intensity, which is moderate, 12 hertz frequency, and 6,000 shocks given per visit. And after few sessions, he reported improved the erectile strength, previously around 2 out of 4, now around 3, and sometimes reaching up until 4 on EHS scale. And since then, he has no failed penetrations, even without PDE5 inhibitors. Case number 2, Mr. SK. He's a 53-year-old. He's known case of diabetes. So he complains of ED for 8 months with EHS of grade 2 and IIEF score of 14/30 for erectile domains. So we started him on ESWT, 60 to 80% intensities, 12 hertz frequency, and 6,000 shocks for each and every visit. After 5 sessions, assessment by IIEF and EHS score, patient claims about have improvement of about 70% without PDE5 inhibitor, but increased to 80% if he consumes PDE5 together with ESWT. So the EHS also, grade also improved from 2 to 3, sometimes up to 4 with PDE5, and no failed penetrative SI. SI is sexual intercourse. So I would like to stress here, from our experience of treating patients with ED, our take-home message is ESWT is safe, it is non-invasive, it is effective, it is simple, adjunct to PDE5 inhibitor for the treatment of ED in GP settings. So it can be used in GP settings. And it is effective from our experience, from our small sample size. We can see around 80% improvement for patients who came with mild to moderate ED. And also from the start of our implementation of ESWT, we have seen significant revenue growth after we decided to incorporate ESWT into our clinic services. Yeah. Thank you, everyone. So this is I've shared our experience in treating patients, ED patients with ESWT in our clinic setting. Hope you guys learn a lot, learn from it. Thank you so much.
Thank you, Dr. Afik, for incredible presentation and very practical presentation. Your talk provides a powerful conclusion to all this webinar, all the speakers, because what you have mentioned was not only clinically effectiveness of the device, of the technology, but also that this modality can be also remarkable business driver. What I liked a lot was, and what I would like to maybe highlight, is that the numbers of the patient you have shared with us is astonishing. Treating over 300 patients in the first 6 months, if I'm not mistaken, and nearly 500 in first 9 months is a testament to the high demand for this kind of non-invasive treatment. The massive patient volume driven by the marketing that you were describing, it's simply showing that incorporating this technology may be a great business decision and essential service for meeting the growing needs in men's health. Thank you very much for your presentation. And now, sadly, we have reached the end of our session and of our presentations. It's been a great session, and we have heard from different specialties, different doctors, different continents. First, we heard from the physiotherapists based in UK, then we heard from urologists from Singapore, and at the end from general practitioner from Malaysia. Doesn't matter the continent or the specialty, I would say that the message is still the same. Focused shockwave therapy is not just a treatment, it's a transformative and great solution with incredible potential for men's health from both perspective, business-wise and also clinical-wise. I would like to thank to all of our speakers for joining us, for sharing the information and showing their approaches and extremely great experience with it. We hope you found this session both informative and inspiring. It's all from us for now, so goodbye, and we are looking forward to seeing you on our next event. Thank you very much and have a nice day.